In this video, I'll cover 10 essential community pharmacist interview questions, providing expert guidelines, ideal responses, and real-life scenarios to help you excel in your interview. This is one of 25 videos designed to fully prepare you for a community pharmacist interview. So, let's begin. Question 11. What do you know about the role of a pharmacist in the Irish healthcare system? The following are guidelines on how to approach this question. Employers ask this question to assess your understanding of the pharmacist's role in patient care, your awareness of professional responsibilities, and your knowledge of the Irish healthcare system. Your response should demonstrate a strong grasp of pharmaceutical care, collaboration with other healthcare professionals, and compliance with regulatory standards. Emphasize skills such as medication management, patient counseling, public health promotion, and teamwork within multidisciplinary settings. Show that you understand the importance of safe and effective medication use while supporting patients' health and well-being. When answering this question, avoid vague responses, overly generic statements, or a narrow focus only on dispensing medications. In Ireland, pharmacists must operate within the Pharmaceutical Society of Ireland, PSI, guidelines, including the Pharmacy Act 2007, which governs the practice of pharmacy and ensures high standards in patient care. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. The role of a pharmacist in the Irish healthcare system is crucial in ensuring safe, effective, and evidence-based medication use. Pharmacists work in community and hospital settings, providing expert advice on medicines, preventing medication errors, and improving patient adherence. In a community pharmacy, we are often the first point of contact for patients, offering health advice, vaccinations, and chronic disease management. We collaborate with general practitioners, nurses, and other healthcare professionals to optimize patient outcomes, particularly in cases of polypharmacy, antimicrobial stewardship, and medication safety reviews. Pharmacists also play a role in public health, such as promoting smoking cessation, weight management, and emergency contraception services. In line with PSI regulations, I ensure compliance with prescription validation, controlled drug management, and the delivery of high-quality pharmaceutical care to enhance patient safety and health outcomes. Example scenario. I remember when a patient with type 2 diabetes came to the pharmacy, struggling with poor blood glucose control and non-adherence to their medication due to side effects. I reviewed their medication history, identified that they were experiencing gastrointestinal discomfort from metformin, and discussed alternative options with their GP. The doctor adjusted their dosage and introduced a modified release formulation, which improved their tolerance. I then provided counseling on diet, blood sugar monitoring, and the importance of medication adherence. A few weeks later, the patient returned, reporting better symptom control and improved confidence in managing their condition. This experience reinforced my role in medication optimization, patient education, and collaboration with other healthcare professionals to improve patient outcomes. Question 12. How do you handle a situation where a patient experiences an adverse drug reaction? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's ability to manage adverse drug reactions, ADRs, efficiently while prioritizing patient safety, following pharmaceutical regulations, and communicating effectively with patients and healthcare professionals. The interviewee should demonstrate clinical judgment, problem-solving skills, and knowledge of pharmacovigilance protocols. A strong response should outline the pharmacist's immediate actions to manage the reaction, documentation procedures, and communication with relevant healthcare providers. Additionally, the answer should emphasize the importance of patient education and follow-up to prevent future occurrences. When answering this question, avoid vague or overly general responses that do not demonstrate a structured approach to handling ADRs. The Pharmaceutical Society of Ireland, PSI, guidelines on adverse drug reaction reporting and EU pharmacovigilance regulations require pharmacists to report serious ADRs to the Health Products Regulatory Authority, HPRA, which should be mentioned if relevant. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a patient experiences an adverse drug reaction, my first priority is ensuring their immediate safety. If the reaction is severe, such as anaphylaxis, I would call emergency services, 112 or 999, and administer first aid if necessary. For mild to moderate ADRs, I would assess the symptoms, review the patient's medication history, and identify potential causes. I would then provide appropriate guidance, which may include dose adjustments, discontinuation, or switching medications after consulting with the prescriber. Additionally, I would document the reaction thoroughly in the pharmacy records and report serious ADRs to the HPRA via the National Reporting System. Lastly, I would educate the patient on what symptoms to monitor, when to seek medical help, and ensure they feel supported throughout the process. Example scenario. I remember when a patient came in complaining of severe itching and swelling after taking amoxicillin for a chest infection. Recognizing the symptoms as a potential penicillin allergy, I advised the patient to discontinue the medication immediately and seek urgent medical attention. I also contacted their GP to recommend an alternative antibiotic, ensuring continuity of treatment. After confirming the allergy, I updated their medication record to prevent future exposure and reported the ADR to the HPRA. The patient later returned to thank me, as their GP confirmed it was a true allergy, and this intervention prevented a more serious reaction in the future. Question 13. Can you explain the regulations around controlled drugs in Ireland? The following are guidelines on how to approach this question. Employers ask this question to assess a candidate's knowledge of Irish regulations on controlled drugs, including storage, prescription, dispensing, and record-keeping requirements. The interview expects the pharmacist to demonstrate familiarity with Irish legislation, particularly the Misuse of Drugs Acts 1977 to 2016, and adherence to Pharmaceutical Society of Ireland, PSI, guidelines. It is crucial to highlight patient safety, legal compliance, and ethical responsibility when handling controlled drugs. When answering this question, avoid giving vague or overly general responses that lack references to specific laws, schedules, or pharmacy procedures. In Ireland, pharmacists must comply with the Misuse of Drugs Regulations 2017, which classify drugs into schedules based on their risk of abuse and medical use. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Controlled drugs in Ireland are regulated under the Misuse of Drugs Acts 1977 to 2016 and the Misuse of Drugs Regulations 2017, which classify drugs into 5 schedules based on their potential for misuse. Schedule 2 drugs, such as morphine and oxycodone, require a handwritten prescription, are subject to strict dispensing controls, and must be stored in a locked CD cabinet. Pharmacists must maintain a CD register, recording each transaction in a bound book or electronic system, and ensure accurate stock reconciliation. Schedule 3 drugs, like pregabalin, also require special prescription controls, while Schedule 4 drugs, such as benzodiazepines, have fewer restrictions. It is our duty to verify prescriptions, cancel patients appropriately, and comply with PSI inspections and audit requirements to prevent misuse and ensure patient safety. Example scenario. I remember when a patient presented a handwritten prescription for morphine with missing legal details, including the total quantity in words and figures. As per the Misuse of Drugs regulations, I could not dispense the medication until a legally valid prescription was provided. I immediately contacted the prescriber, explained the legal requirements, and requested a corrected prescription. While waiting, I reassured the patient, explaining that the delay was necessary for legal compliance and patient safety. Once the correct prescription was received, I accurately recorded the transaction in the CD register, ensuring that both legal requirements and patient needs were met. Question 14. What is your experience with vaccinations in a pharmacy setting? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's clinical competence, regulatory knowledge, and patient communication skills regarding vaccinations. The interview expects the candidate to demonstrate experience with vaccine administration, cold chain management, patient counseling, and compliance with Irish pharmacy regulations. It is also important to highlight the ability to manage vaccine hesitancy, ensure patient safety, and document vaccinations correctly. When answering this question, Avoid giving vague or overly general responses without specific details about hands-on experience or knowledge of Irish vaccination policies. In Ireland, pharmacists must comply with the Pharmaceutical Society of Ireland, PSI, guidelines, the National Immunisation Advisory Committee, NIAC, recommendations, and the HSE National Immunisation Programme when administering vaccines. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I have extensive experience with vaccinations in a community pharmacy setting, including administering flu vaccines, COVID-19 vaccines, and pneumococcal vaccines. I ensure that all vaccines are stored correctly within the cold chain, following PSI and NIAC guidelines, and that I screen patients for contraindications and precautions before administration. Additionally, I am skilled in communicating vaccine benefits, addressing concerns about side effects, and ensuring informed consent. I also maintain accurate documentation in line with HSE requirements and update patient records on HealthMail and the PCRS system. I have attended mandatory vaccination training and CPR certification, ensuring that I am fully compliant with HSE protocols. My approach prioritizes patient safety, efficiency, and professional communication, ensuring that every vaccination is delivered effectively and confidently. Example scenario. I remember when a nervous patient came in for a flu vaccination, expressing concerns about potential side effects due to a previous reaction to another vaccine. I took the time to explain the differences between flu vaccines and other vaccines, reassured them about the mild and temporary nature of common side effects, and addressed their specific concerns using NIAC guidelines. After confirming that there were no contraindications, the patient decided to proceed with the vaccination. I administered the vaccine safely, monitored them for 15 minutes post-administration, and provided aftercare advice and a vaccine information leaflet. The patient later returned for their COVID-19 booster, stating that my thorough approach and clear communication had increased their confidence in vaccinations. Question 15. How do you manage workflow during busy periods in the pharmacy? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's ability to handle high-pressure situations while maintaining accuracy, efficiency, and patient safety. The interviewer wants to see strong organizational skills, leadership, and adaptability in managing workflow. A good response should highlight strategies such as prioritization, delegation, teamwork, and time management, ensuring that all tasks are completed efficiently without compromising patient care. Demonstrating knowledge of pharmacy operations, including prescription processing, inventory management, and customer service, is essential. When answering this question, avoid vague or generic responses that do not showcase specific strategies or real-life experiences. In Ireland, pharmacists must comply with PSI's Code of Conduct and the Misuse of Drugs regulations, ensuring safe and effective medication dispensing even during peak hours. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. During busy periods, I focus on efficient task prioritization, clear communication, and teamwork to ensure smooth pharmacy operations. I begin by triaging prescriptions, processing urgent and high-risk medications first while ensuring that routine prescriptions are completed promptly. I delegate non-clinical tasks to the pharmacy team, such as checking stock levels or managing customer queries, so I can focus on verifying prescriptions and providing patient counseling. I also ensure that our standard operating procedures, SOPs, are followed to maintain safety and efficiency. Communication is key. I keep the team informed about workflow priorities and encourage collaboration. If necessary, I proactively manage customer expectations by providing realistic wait times and offering alternative solutions such as text notifications when prescriptions are ready. Example scenario. I remember when our pharmacy had an unexpected surge in patients during flu season, with a high demand for both prescription medications and vaccinations. I immediately reassigned tasks, asking the technician to focus on dispensing and stock management, while I handled clinical checks and consultations. I also directed an OTC assistant to help patients with minor ailments to ease congestion. At one point, a patient required urgent antibiotics, so I expedited the dispensing process while ensuring accuracy. By staying calm, prioritizing critical tasks, and maintaining open communication, we managed to process all prescriptions efficiently while still providing high-quality care. This experience reinforced the importance of adaptability and teamwork in managing workflow during peak times. Question 16. Tell me about yourself. The following are guidelines on how to approach this question. Employers ask this question to assess your professional background, key skills, and suitability for the role. Your response should be structured, starting with a brief introduction of your qualifications, work experience, and key strengths relevant to community pharmacy. Focus on skills such as clinical knowledge, patient counseling, medication safety, and regulatory compliance, as these are essential for the role. When answering this question, avoid giving irrelevant personal details or a disorganized response that lacks a clear professional focus. Ensure that your response aligns with the Pharmacy Act 2007 and the guidelines of the Pharmaceutical Society of Ireland, PSI, regarding professional responsibilities in a pharmacy setting. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I am a qualified pharmacist with extensive experience in community pharmacy, where I have developed strong skills in dispensing, patient counseling, and medication safety. My background includes working in high-volume pharmacy settings, where I have ensured safe and effective use of medications while providing clinical advice to patients and healthcare professionals. I am highly familiar with PSI regulations, the Misuse of Drugs Act, and controlled drug management, ensuring full compliance with Irish pharmacy laws. Additionally, I have a strong passion for delivering patient-centered care and optimizing medication therapy, which I believe is essential for improving patient outcomes in a community pharmacy. I am eager to bring my expertise to this role and contribute to the continued success of your pharmacy team. Question 17. Why do you want to work for our pharmacy specifically? The following are guidelines on how to approach this question. Employers ask this question to assess whether the candidate has researched the pharmacy, understands its values, and aligns with its mission. To answer effectively, the interviewee should demonstrate knowledge of the pharmacy's services, patient care approach, and community impact while linking these aspects to their professional skills and aspirations. Highlighting enthusiasm for the role and showing how personal values align with the pharmacy's goals will make the response more compelling. When answering this question, avoid generic statements that could apply to any pharmacy, as well as overly focusing on personal gain rather than the value the candidate can bring to the pharmacy. A strong knowledge of the Pharmaceutical Society of Ireland, PSI, Code of Conduct is important as it ensures that pharmacists uphold professionalism, integrity, and a patient-centered approach, which should be reflected in the response. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I am particularly interested in working for your pharmacy because of its strong reputation for providing personalized patient care and its commitment to serving the local community. I appreciate that your pharmacy goes beyond dispensing medications by offering clinical services such as medication reviews and health consultations, which align with my passion for delivering high-quality pharmaceutical care. Additionally, I admire how your team places a strong emphasis on patient education and adherence, which I believe is crucial for improving health outcomes. With my experience in medication therapy management and my ability to build strong relationships with patients, I am confident that I can contribute to maintaining and enhancing the high standards of service your pharmacy is known for. Example scenario. I remember when I worked in a busy community pharmacy, and a regular patient struggled with managing multiple chronic conditions. By taking time to provide structured medication counseling and adherence support, I helped them develop a regimen that improved their blood pressure control and diabetes management. Seeing how personalized care made a tangible difference in their health reinforced my passion for working in a pharmacy that prioritizes patient-centered services, like yours. This experience has strengthened my commitment to ensuring that every patient receives not just medication but also the necessary support and education to manage their health effectively. Question 18. What do you consider to be your greatest strength as a pharmacist? The following are guidelines on how to approach this question. Employers ask this question to assess your self-awareness, confidence, an ability to align your strengths with the needs of a community pharmacy. Your response should highlight a key skill or trait that directly benefits patient care, medication safety, or pharmacy operations. Strong answers often focus on clinical knowledge, problem-solving abilities, communication skills, or attention to detail, all of which are essential in a pharmacy setting. When answering this question, avoid generic or vague responses that do not provide clear evidence of your strengths. In Ireland, strong knowledge of PSI guidelines on professional competence and patient-centered care is important, as it ensures pharmacists maintain high standards of practice while demonstrating continuous professional development. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. My greatest strength as a pharmacist is my ability to communicate complex medical information in a way that is clear and accessible to patients. I believe that effective patient counseling leads to better adherence to treatment and improved health outcomes. In my role, I always ensure that patients fully understand how to take their medications safely, recognize potential side effects, and feel confident in managing their health conditions. Additionally, I am skilled at adapting my communication style based on the patient's level of health literacy, ensuring that each individual receives the best possible care. This strength has helped me build strong patient relationships and contribute to a positive pharmacy environment. Example scenario. I remember when a patient with newly diagnosed type 2 diabetes came in feeling overwhelmed about starting metformin and managing their condition. Recognizing their concerns, I took the time to explain the purpose of the medication, addressed misconceptions about diabetes, and provided lifestyle advice in simple, reassuring language. I also demonstrated how to use a blood glucose monitor and encouraged them to ask questions. As a result, the patient left feeling more confident and later returned to thank me for making the transition to treatment easier. This experience reinforced my belief that effective communication is a pharmacist's most powerful tool in improving patient health outcomes. Question 19. What is your biggest weakness, and how are you addressing it? The following are guidelines on how to approach this question. Employers ask this question to assess a candidate's self-awareness, problem-solving skills, and commitment to professional growth. A strong response should demonstrate an ability to identify areas of improvement and show a proactive approach in addressing them. The ideal answer should focus on a non-critical weakness that does not significantly impact patient safety or core pharmacy responsibilities while showing steps taken to overcome it. When answering this question, avoid mentioning weaknesses that directly compromise patient care, regulatory compliance, or professional ethics, such as poor attention to detail or difficulty in handling high-pressure situations. In a pharmacy setting, strong knowledge of the PSI Code of Conduct and the CPD, continuing professional development, requirements is important, as it ensures pharmacists engage in lifelong learning to enhance their competencies and uphold professional standards. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. One of my biggest weaknesses has been delegation, as I sometimes find it difficult to entrust certain tasks to others, preferring to handle them myself to ensure accuracy. However, I have recognized that effective delegation is essential for efficient workflow in a busy pharmacy. To improve this, I have been actively working on communication and leadership skills, ensuring that I give clear instructions and provide appropriate support when delegating tasks to colleagues. Additionally, I have sought mentorship from senior pharmacists and engaged in CPD courses on leadership and team management to build confidence in this area. As a result, I have become much better at prioritizing responsibilities and trusting my team, ultimately leading to improved efficiency and a more collaborative work environment. Question 20. How do you handle stress in a busy pharmacy environment? The following are guidelines of how to approach this question. Employers ask this question to assess your ability to manage high-pressure situations while maintaining accuracy, professionalism, and patient safety. A strong response should highlight time management, prioritization, teamwork, and resilience, as these are essential skills for a community pharmacist. Demonstrating that you can remain calm and effective under pressure reassures employers that you can handle peak periods, multitask efficiently, and ensure compliance with legal and professional standards. When answering this question, Avoid giving vague or overly personal responses that do not relate to pharmacy practice, such as general comments about handling stress in daily life. Strong knowledge of the PSI's, Guidance for Pharmacists on the Safe Supply of Medicines, and the Code of Conduct for Pharmacists, is important as it ensures that patient care is never compromised, even in high-stress situations. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Working in a busy pharmacy environment requires staying composed, organized, and patient-focused. I handle stress by prioritizing tasks effectively, delegating when necessary, and staying adaptable to changing demands. During peak times, I focus on efficient workflow management, ensuring that prescriptions are dispensed safely and accurately while maintaining good communication with both staff and patients. I also practice self-care outside of work, such as mindfulness and exercise, to maintain a clear and focused mindset. By keeping a structured approach to my workload and ensuring open communication with my team, I can manage stress effectively while delivering high-quality pharmaceutical care. Example scenario. I remember when we experienced an unexpected staff shortage during a flu vaccination campaign in a particularly busy winter season. We had long queues of patients, many of whom needed urgent prescriptions, and there was a risk of delays affecting patient care. I quickly assessed the situation and prioritized dispensing high-risk medications first, while also delegating administrative tasks to the pharmacy technicians. I maintained constant communication with patients, keeping them informed of waiting times, which helped to reduce frustration. As a result, we managed to clear the backlog efficiently, ensuring safe and timely dispensing of medications while maintaining a high standard of patient care. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.